think of in other areas of your life. When do you need to give informed consent? When you go on a flight, right? Do you need to give informed consent? Does anybody ask you, do you know all the risk of flying and do you consent to be on the flight? No, people assume that you give consent because you bought a ticket.
I'm pretty sure it's implied.
Exactly.
But when you buy a flight ticket, it's probably going to be in the fine print that there is a risk.
Nobody reads the fine print.
I do. Hi, everyone. Thank you for tuning in. Today, we're talking about the legacy of the Tuskegee syphilis study and its impact on research ethics. We are going to take a deep dive into one of the most notorious and tragic examples of medical misconduct in U.S. history and in the history of the whole world. Commonly referred to as the Tuskegee syphilis study, was a clinical study conducted between 1932 and 1972 by the U.S. Public Health Service in collaboration with the Tuskegee Institute. The goal of the study is to observe the natural progression of untreated syphilis in African American men. But there is a disturbing twist to this scientific study. The study involved 600 black men, 399 of whom had syphilis, and 201 who did not. These men were told that they were receiving treatment for bad blood, a very vague term used to describe a variety of ailments back in the days. They were never told they had syphilis, and they certainly weren't informed about the real purpose of this so-called medical study. In exchange for their participation, these men received medical exams, meals, treatment for minor illnesses, and even a burial subsidy. But what they did not receive, tragically, was treatment for syphilis itself, a deadly disease, even when an effective cure became available later on in the study. When this experiment began in 1932, there was no proven treatment for syphilis, and the study and the disease was largely untreatable. But by the mid-1940s, that all changed. Penicillin, an antibiotic, had emerged as a standard treatment for syphilis, offering a way to safely and effectively cure the disease and prevent its devastating complications. And yet, the researchers made a horrifying decision. They deliberately chose not to offer penicillin to the men in the study, and instead continued to observe the progression of the disease, knowing full well that untreated syphilis could lead to severe health complications and even death. Let's pause for a moment to reflect on what that means. These men were led to believe that they were receiving proper medical care, and these are a marginalized community back in the days. It is difficult enough for them to get medical attention. Meanwhile, the disease silently ravaged their bodies and they unknowingly spread syphilis, a very infectious disease, to their sexual partners and children. And the researchers allowed this to happen for 4 decades, 40 long years, while these men suffered, all in the name of so-called science. The unethical violations of the Tuskegee study are profound. There was a complete lack of informed consent. The participants were not told about their syphilis diagnosis, the actual purpose of the study, or the option to withdraw. Most significantly, they were denied a life-saving treatment that was already available. This wasn't just a failure of medical care. It was a violation of human dignity and basic ethical standards. The men in the study, their families, and the communities paid a heavy price, physically, emotionally, and over generations. It wasn't until 1972 that the public learned about the study, thanks to a report by the Associated Press. The outrage was immediate and widespread. Soon after, the Tuskegee study was terminated, but the damage was already done. A lawsuit followed, leading to a $10 million settlement for the study's participants and their families. And in 1997, U.S. President Bill Clinton formally apologized to the survivors of the study and their descendants, acknowledging the terrible injustice that they had endured. We can think about that. Is this apology too late? Does it mean anything to the men who have already lost their lives, and the children, their descendants, that are severely affected by this unethical study. The Tuskegee study had a lasting impact on the world of medical research, prompting serious reflection on the ethics of how human subjects are treated. One of the most significant outcomes of this reflection was the establishment of the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. This commission led to the creation of the Bellman Report in 1979, a foundational document in research ethics outlining 3 key principles that guide human research today: respect for persons, beneficence, and justice. We will talk about the Bellman Report later on in the course. These principles were designed to prevent abuses like the Tuskegee study from happening again. But there is an important question. Are these 3 principles enough for today's ever-evolving research landscape? Some scholars argue that the Bellman Report, although groundbreaking at the time, may no longer be adequate for addressing the complexities of modern research. There are new technologies, data collection methods, and forms of research that are pushing the boundaries of what the traditional principles can regulate. Critics say that the focus needs to shift from simply protecting participants from harm to encouraging their fair participation and ensuring equitable access to the benefits of research. So what do you think? Is it time to rethink the ethical frameworks that guide medical research? How can we ensure that tragedies like the Tuskegee study will never happen again? And when we look at other infamous cases, like the atrocities committed in the Unit 731 during World War II, how do the lessons from Tuskegee resonate? Are the Bellman Report's principles of respect, beneficence, and justice enough? Or is there room for more? These are difficult questions, but they are critical to ensuring that medical research moves forward in a way that respects and protects all people. Thank you for joining us today. The legacy of the Tuskegee Syphilis study is a powerful reminder of what can go wrong when ethics are cast aside in the pursuit of knowledge. But it also serves as a call to action for us to build a future where medical research is conducted with respect and ethical standards for human life and dignity.
Yeah. Okay, what I'm thinking is I would ask you about what do you think is the most unethical concern in this experiment? Something like that. I talked about informed consent a little bit, but it's very brief. So I gave a very brief summary, so you can elaborate more on that.
Okay.
Yeah. So I'll mainly be asking questions and follow up.
Well, I will respond to questions. I'm Jewish.
Include that.
It's recording.
Well, I mean, honestly, yeah, you can include that. That could be a good introduction. I mean, this part might be a good introduction. You know? No? Could be cool.
I don't know.
Anyway.
Okay.
But sure, yeah.
Yeah. Okay, so Zohar, I gave a brief summary of the Tuskegee study. What do you think is the most concerning thing
about the Tuskegee? Well, I think so. There are a lot of things that didn't work well, or indeed went really badly in the Tuskegee trial. The first thing was there was not informed consent. So the subjects did not know what kind of disease they have because they were never told, and they thought they are getting treatment or at least primary care and follow-up. And they didn't. Basically, the researchers didn't care about them. They just cared about advancing their own science. But in more general terms, I think the Tuskegee study represents, or it's a culmination of what has been named iatrophobia, or it's a way to justify, or another landmark to justify the iatrophobia of American blacks in the U.S., of black Americans in the U.S., which means that, the lack of trust in the medical institution, in the healthcare institution. And the Tuskegee really represents, or it tells us why, and this is still the case. We saw that with COVID. Then, when we ask why is it that a lot of African blacks didn't vaccinate against COVID is because they don't trust the healthcare system. Why don't they trust the healthcare system? Partly or mainly because of Tuskegee, because they learned about this history where white men working for the US government basically deceived them and didn't care to treat them or care for them when they had syphilis.
I think that's a very good point. It all plays into the historical context of where black people, the community is back in the days. I think it's a very marginalized community and they don't really get health care at all. So when they heard about the study and that the US government, like a very trusted government, is giving them free health care, they're going to put a lot of trust in that. And over 40 years, they believe that they're getting treated. They weren't even told of the diagnosis of syphilis, were they? Yeah, it was just a very vague bad blood. So they didn't know what's going on with them and they thought they're getting treated and turns out they're not, even when there's treatment available. I think that's just a horrifying thought. Yeah, I think it's a very good concern.
Yeah, absolutely. So, we always, when we learn about research ethics, we learn about clinical ethics, we learn that informed consent is the thing that matters most, right? The normal code, first principle, first point is the duty to have informed consent. Absolute duty. Absolute necessity. But, when you do clinical work, you realize a lot of patients don't really need to be informed. They don't want to be informed, and they don't care so much about consent, right? If they come to the hospital, they want to receive care. We still, obviously, I'm not saying we should dismiss it and not ask for it, but oftentimes in classroom discussions, when we teach ethics, we overemphasize informed consent. And in research, again, very important, but it's important also not to overemphasize it. I think much more important than informed consent is the trust and trustworthiness of medical researchers, of healthcare institutions. And with Tuskegee, we really lost it. And we are still seeing the consequences.
Right. So what is the alternative to informed consent?
I don't know if so I think there's no, well, that's a good question. So as an alternative, I think trustworthiness could be an alternative. And I don't necessarily say that should be an alternative. My point is that we may want to de-emphasize the idea of informed consent because we know there are a lot of issues with informed consent, right? No consent is really informed. Or still, we don't know what informed really means, right? To what extent should someone know about all the adverse effects of a drug or a treatment? I don't know. I'm a physician, and I don't know all the adverse effects of drugs that I give to my patients, right? There are numerous ones. So how much informed is informed, right? And then, if people are not wholly informed, then what does it mean to give consent? All I'm saying is we should probably de-emphasize that notion or that necessary condition, and we should really emphasize more the idea of developing or cultivating a feeling of mutual trust going between healthcare institutions and the public or patients and vice versa. Right now, again, I think the COVID example, one of the greatest failures in modern times, people refusing to quarantine, to isolate, to get vaccination, is because they didn't trust the healthcare system. They didn't trust scientists. They didn't trust physicians. And there are many reasons for that. One reason is that they have some even basic knowledge of history, and they learned not to trust us, particularly vulnerable specific population like Black Americans.
I mean, I understand your point. You really have to trust the healthcare system. But, we have a long history of, things like the Tuskegee or Unit 731, these kind of research ethics violation happening that kind of undermines the general public's trust to the healthcare system. And it's a very long process to build trust. Some people even say that it's an irreversible thing. So in the process of trying to gain back that trust, I feel like informed consent is still a pretty useful tool to help people understand that you're caring for them, that you're doing this for them. And, some patients, they really just want to be informed and make their own choice. I think it's a delicate balance between, being way too paternalistic. I make the decision for you because I'm your physician and I care about you, or you just give them the information. And, of course, it's justifying, not providing sufficient care for the patient because they're informed. It's not really an excuse, But I feel like there are some essential things that you're supposed to inform your patients and let them choose their own care. In the Tuskegee study, very key informations are missing. They don't even know their diagnosis. They don't know, that there's treatment available, the risk of these treatment. I still feel like there is a pretty big role that informed consent should play in today's world.
Yeah, look, again, I'm not sure I want to take on this argument. But if you think about it, why do we talk so much about informed consent, right? Informed consent, again, the modern version, the reason why we emphasize it so much is the Nuremberg Code. It existed in, for example, in Prussian regulations before the Nuremberg Code since the beginning of the 20th century, but still that's why we know about it, right? So first principle, the necessity of informed consent. Why? Why did it appear as the first principle of the Nuremberg Code? Because the Nazi researchers basically violated the trust of, Jewish and other population, like the Gypsies and other European populations, right? Basically, the healthcare institution as a whole lost its trustworthiness. That's why the idea of the concept of informed consent became so important, so essential, right? So in a way, you can think about it as a continuum. Whenever you have trust, and whenever you have institutions that are trustworthy, I'm not saying you don't need consent, but I'm saying it might be, you can be more lax about it, right? But think about in other areas of your life. When do you need to give informed consent? When you go on a flight, right? Do you need to give informed consent? Does anybody ask you, do you know all the risks of flying and do you consent to be on the flight? No, people assume that you give consent because you bought a ticket, right? And in general, the reason why we fly is because we trust the pilot not to kill us. The same thing goes on a bus. Do you give informed consent when you go on a bus? There are risks, right? When you go on a taxi, do you sign an informed consent when you go on a taxi? No.
I'm pretty sure it's implied.
Exactly.
But when you buy a flight ticket, it's probably going to be in the fine print that
exactly.
There is a risk.
Nobody reads the fine print.
I do.
Well, we talked about that already.
I mean, but yeah, that's a good discussion. When you sign up for an account on Facebook, you have to read all that fine print.
Who reads that?
You are supposed to, just because you don't.
But that's exactly who reads informed consent.
That's why you don't trust Mark Zuckerberg. See? That's the thing. He did give you informed consent. He just did it very trickily and cunningly. You're supposed to read it. You're supposed to know. And I don't. I don't. You just talked about your data being stored somewhere, so you do know. And that's kind of a risk that you take on to enjoy the benefits of social media.
But that's also everything we do. You go to the mall, your data are entered into a database.
I'm pretty sure you're informed of that.
You're going to the hospital, and your data are entered into a database without you giving consent. When do you give consent when you go to the clinician? In clinical care. When do you give consent?
I'm pretty sure you sign some papers when you get admitted. If you get like an actual patient number.
You don't.
You sign papers.
No.
No?
No.
Wow, that's news to me.
But not even admitted. When you get to go to the hospital and you get tested or you're examined by a emergency medicine physician. unless you undergo a procedure, you don't sign anything. What's the difference? How does research work, right? So let's say, university-based research. Usually, they take students, right? And you see an ad on Facebook or whatever on a billboard, and you go, you call them, you email them, you go there. They tell you what the research is about, and you do it, and you get some money or snacks or whatever. Why do you need informed consent for that reason?
I mean, I do agree with you that there is distrust, and you're trying to make people trust you.
Yeah.
But it happens everywhere too.
Absolutely.
Yeah.
But why do we insist on in the clinical or medical context, research or clinical, why do we insist on informed consent then? Where do you have informed consent? So you talked about informed, right? Allegedly. But we don't insist on it being informed, right? Nobody asks you, "What? Did you read the fine print?" And you're not asked to sign it. So
You are. When you log onto Facebook and you sign up an account, there are actual lawsuits about this. You have
You
to
did it
click
for the first time.
agree.
For the first time.
Yeah, because you agree to everything already. But that is informed consent.
So why not do that why not have a database, or whenever you do your first research, you sign up for your first research, your first study, you sign informed consent, a blanket informed consent. I consent to all research projects.
That is unethical. We're trying to make research more ethical than maybe Facebook. Isn't that a good thing? Just because other industries are not ethical.
Yes, obviously we want to. It's a different thing. My point is, what I fear is that we put too much emphasis on informed consent and we forgot about the other things that matter. It's not about informed consent, or it's not mostly about informed consent. It's about transparency, openness, being inclusive, including patients in the decision-making process, allowing critique from other stakeholders in society, and not restricting ourselves to our institution. And basically we are too afraid of criticism. That's the medical institution as a whole, too afraid of criticism.
That's true, I agree with you.
That's what I think we should emphasize.
Yeah. I think if you overdo informed consent to a certain point, it becomes like a thing to protect yourself.
Exactly. But
to avoid getting sued.
Exactly. But that's exactly the point.
Yeah.
That's exactly the point. We learned that that's what you need to do. And, it's the same as IRBs. The concept failed. Institutional review committees, as research committees, they failed. They don't work properly because we put too much emphasis on them.
I 100% agree with you, especially with the IRB. So much paperwork, so little actual reviewing has been done.
Exactly.
That's true.
Exactly. And then you have people doubting the institution of bioethics because they think that IRBs are bioethics, and that's not the case at all. IRBs are just, it was just I don't know if it was a bad idea, but bad implementation.
That's true. Yeah. Discussion. You may trust the pilot, but I think a lot of people don't actually trust it. Flight companies on a lot of things. They don't take accountability for when things happen. So it's true. Like, you only need informed consent when there's inherent mistrust. But if you see it in a positive light, isn't it better that, the general public is, I wouldn't say mistrust is good, but they're questioning authority more. I don't know if that's happening in Hong Kong, but I think in the US, like, people are, starting to take matters into their own hands.
Yeah, absolutely. But why is that? That's exactly the point. Why is that? So this links beautifully to the origins of research ethics, which really is the Tuskegee trial, right? What happened there? The Tuskegee trial, or our discovery of the Tuskegee trial, right? And coupled with human rights movements, right, in the U.S. and the Vietnam War and everything, basically symbolized a deep distrust of the American population in the government, right? In policymakers, in people with power. That's I think the story of all of it. If you look at it from a grand scale, and that's why we started talking about informed consent and the necessity of the importance of informed consent, because we lost trust in the historical structures that existed, political, social structures, right? If that did not happen, if the Vietnam War did not happen, if human rights, if women in the U.S. and blacks always had rights, we didn't have to deal with that, and there was no breakdown of trust in the system. But because people became aware, oh, wait a minute, I should have my rights. I've been discriminated against so far. Then you have the origin of the lack of trust in the system, and the system trying to accommodate that, all of a sudden requiring informed consent. The same thing applies to, I think, to the healthcare system. And that's why we emphasize it so much. Well, part of it because we try to do the right thing, and part of it because we know that we lost our, and I'm not saying it's not justified, but we lost our authority, and we can no longer be paternalistic about it. And we know that what we say, both as researchers and clinicians, patients or participants might not listen, right? So it became much more formal. Informed consent is part of that formality.
That's very true. I think it ties back to the point I made earlier in the overview of the study. The Bellman report was, made kind of as a response to the study. And it laid out 3 principles. I think it's very key, respect for people, beneficence, and informed consent. But it doesn't all encompasses what research ethics should be. I think it should be reflective of, social issues, what's happening, historical context, how the general public's relationship with the government, with the healthcare sector should be. So if I have to ask you one question, if you can add 1 or 2 or multiple principles to, these 3 that we have in the Bellman report, what would you give?
So, well, first of all, the Belmont report, right? So it was also justice, right? They also talk about justice because of, I think that's exactly the point. Where, justice applies to public health, but justice also applies to clinical care. And this is the notion that you should treat similar patients similarly, right? Whether they are black, white, women, whatever, you should treat them similarly, equally or equitably. So that's why. If I had, and this is just not me, right? This is not just me. This is a lot of people are talking about it, that we should add concepts like, or we should remember or remind ourselves or emphasize trustworthiness, right? Some people talking about we should tell the truth all the time, be genuine. But I think if I had to pick one and add one and start teaching that, especially here at HKU, medical students learn about the 4 pillars of medicine, which is really the 4 principles of the Georgetown mantra. If I had to add one thing to it, well, first, honestly, I would get rid of non-maleficence, but we can talk about it later. But I will add trust or trustworthiness. Individual physicians, healthcare institutions, research bodies need to regain the trust of potential subjects, potential patients, and the way to do that is by being trustworthy.
Right. How do you do that? How do you
That's a wonderful
convince people to trust you? Especially in today's world, there's so many wrongs happening in the world. It's very difficult to trust a doctor. Even, as a young person, even as a medical student, I feel like sometimes, doctors do questionable things. Or we make decisions that are so complicated, it's very difficult for a layman to understand. And, as a general member of the general public, you don't really care much else other than, you want to be helped. You want people to listen to you, and it's very difficult, especially in Hong Kong. A doctor barely has time to listen to a patient, and sometimes you make wrong diagnosis, or as a patient you feel not really cared for. So very difficult to gain trust, especially when we talk about all these historical context behind. Yeah. Well,
Absolutely. So I think it's a great question. I would say one thing: increase transparency and public access. All right. So basically, do away with this separation between the public or communities and the science or the scientific method. So let me give you an example, not necessarily from research. The New England Journal of Medicine recently came out with a series of articles basically apologizing. So they elicited articles from leading historians in the US, basically apologizing to vulnerable populations about writing or publishing research that was done unethically on them, right? One of the pieces was about the attitude of the healthcare institution at the time, both in terms of clinical practice, but mostly research, towards Black Americans, African Americans. The same historian later noted, and this was in a conference in Boston, where you used to be, that, the journal apologized for that, but there was no word about Gaza. Right? The same could be said about the Japanese experiments, right? We know that these people, the researchers, Japanese researchers, publish their research, right? Sometimes they call their subjects, they refer to them as monkeys, right?
Or logs.
Or logs, but I don't know if they mention that in the articles. But monkeys, or they actually said they call them coolies, right?
What is that?
So Chinese. So that was a nickname for Chinese at the time.
It's a slur.
Yeah.
Wow.
Obviously, it's a slur. Yeah.
Okay.
But basically, it's humans, right? So think about it. If there was, and I know that was a long time ago, obviously, right? World War II, we didn't have internet then. But if there was, but now we can do that, right? Now we can open that scientific publications to the public. So think about it now. If the public were to learn now that, Chinese civilians are being tested on, they might have a problem with that. The same way as the public right now, the international community, has a problem with what's going on in Gaza. Right? So transparency is one answer. Obviously, it's not absolute, right? Or it's not the only solution. I would say another solution, or something that we have to do, is basically to cultivate, encourage more social and political activism. And this is not up to us. This is part of, school teachers and high school teachers, to teach us how to be more involved and more knowledgeable and pursue, knowledge of what's going on around us. Read newspaper and try to be more active and promote good.
Right, yeah. I think these are very good reminders of what we should do. It's definitely going to be long processes, but it's directions that we should head for. Yeah.
Yeah, great.
Can you wrap it up, like a debrief?
Well, debrief is we talked about the historical context of the Tuskegee Syphilis study, the kind of injustices that were brought upon the people that are affected, to the community, and why it's so horrible, especially given the historical context, and how it leads to the larger but broader consequence of just, marginalized communities generally not trusting healthcare system. And it's a huge concern, because when it comes to the pandemic, COVID, people are risking their lives not getting treatment or, getting the vaccines just because of all these historical wrongs that has been brought upon to the communities. And it takes a really long time to kind of, undo those historical harms. I think Zohar gave very good, reminders for us to be accountable, to be transparent, and really to reflect on, what's been happening in history. And I think that's also what we want to do in this project. We want to, dig into the past and see what kind of atrocities had happened and, really bring people to be aware of these kind of issues so we can all be in a better direction to, be in a better relationship with the public. Anything to add on?
No, I completely agree with that. And I think one thing that I would say is research ethics is not all about informed consent, and there's much more to it.